This is Tiruchirappalli. Yes.
Okay, thank you, sir. So good evening and welcome to you all. So if you look back from Monday to Thursday, first 2 days we covered the 13 steps of counseling, especially the integrated model of counseling. Then yesterday we covered about how to counsel the children and adolescents, what are our role as a counselor. So today we are going to see something how to counsel the adults and the elderly. So the first PPT you can see here, the aim of counseling adults. The important points are here, enhancing mental well-being or mental health. Second point is relationship, and the third is professional growth. There are many other, but I have just taken the core point as such, these three: mental health of the person, building relationship, and professional growth. So according to the study done by Elizabeth Hollock, the early adulthood is from 18 to 40 years, because different studies shows different ways. So that's the reason I have mentioned the name according to Elizabeth Hollock. So the middle adulthood or a middle age is from 40 to 60 years. Late adulthood or old age is from 60 to till the death of our. So again, this has been taken from Levinson's theory. In his book, he says, early adult transition takes place between 17 to 22 years, but some say it is from 18 to 25. Other studies says. So this is the time adult will be leaving home, leaving family, making their first choice about career and education. So there is a conflict goes on in the person's mind. There comes an imbalance in their emotions, because not sure how you are going to be. Though you have an aspiration, the end is not clear. The second part of it is adult world, that is 22 to 28, committing to an occupation, defining goals, finding intimate relationships. Then at the age of 30, transition takes place. It is between 28 to 33, re-evaluating those choices and perhaps making modifications or changing one's attitude towards love and work. So these theories will help us to understand how the adulthood different stages are taking place, and how the mental or the attitudinal change is taking place, how we are, the process of thinking that is happening. So at the age between 33 to 40, settling down age, reinvesting in work and family commitments, becoming involved in the community. Nowadays, well in advance also people get settled, but this is a one study that says, again, midlife transition takes place from 40 to 45. Re-evaluating, here it is not reinvesting, here re-evaluating previous commitment, making dramatic changes if necessary, giving expression to previously ignored talents or aspiration, especially they would have had a dream job. If they are not able to, they still try. Or some skills that they learned in their younger age, if they are not able to, they try to achieve in this age, feeling more of a sense of urgency about life and its meaning. Here they try to analyze, what is life for me? What is the meaning of life for me? Then the next point is entering into the middle adulthood, that is from 45 to 50. Here they ask themselves, committing to new choices made and placing one's energies into these commitment. There can be some changes, so they will give total commitment to what they are thinking. So this is a scenario in an adult stage. From the previous counseling, what are some of the questions the counseling setup they have asked, the adult have asked? Always they have a tendency to think, what is keeping me tied to my parents? See, all my friends are moved out. I do not feel ready to live on my own yet. They look for autonomy, independence, but yet there is no confidence in themselves. Is it all right to have beliefs that are different from those of my parents? Some start questioning themselves, should I follow the parents, maybe if they are Christians or Hindu, should I follow the same, or should I have my own different way? Then what are my fears, anxieties about independence? What do I do if I cannot succeed on my own? Again, lack of self-confidence, do not know how to go ahead. As a result, fear and anxiety occurs. Then, how well do I know myself? Still in a dilapidated stage they are, do not know about themselves. How do I recover who I really am and what I really want? It's again self-talk that is going on, asking themselves this type of questions. What I really want in my life? Have I achieved so far? Then what are my values and goals? I did not know if my values are my own or if I only hold them because I learned them from my parents. So this is the scenario of an adult who comes to us for counseling. These are the self-talk they are having. At times it can be so positive or negative, but they go through a struggle within themselves, which they think it's not supposed to be said it out. Especially again, when we look at the gender, at least females will share certain things, males still hold on because the emotional maturity has not occurred. As a result, this type of questions can arise and they are not able to find a solution by themselves. So it is essential for them to get a consultation with a counselor and make sure whether their values are worthwhile or do they have a clarity in their life. So keeping this background, let us ask, what is adult counseling? A therapeutic process aimed at addressing, keep in mind, emotional, social, professional challenges faced by adult. Here I am mentioning 3 different aspects because these are the main one. There are also other sub, but I am at least this much, if we are thorough with it, it's easy for us. Emotional, social, and professional challenges. Again, helps individuals navigate life transitions because as an adult, lot of transition is taking place. Seeking for a job, getting settled, marriage, pregnancy, all this is the different transition that is taking place. As a result, lot of stress takes place. Maybe wanting to have a job in your own place, native place, maybe you'll have to shift that place to some other place. All these are giving a lot of stress and it's a personal growth. Uses approaches such as usual we says, cognitive behavioral therapy, life coaching, and talk therapy. Its simple term is counseling as such. So now let's look at what are some of the objectives of adult counseling. This is to support mental health and mental well-being, help individuals cope with stress, anxiety, and depression, improve communication and relationship skills, guide career and personal development. So these are our objectives when we go as an adult counselor. So what is our role as an adult counselor? Obviously, emotional support, because from the scenario we have seen that they are going through a type of emotional pain. And as a result, behavioral problems occurs and they do not know how to handle it. So emotional support is very, very essential because that is the basic of all. It provides a safe space for expression and healing, that is a psychological healing. Career coaching, assist in professional growth and workplace challenges, especially in their early adulthood. Then relationship guidance, helps in managing personal and family relationship. Here we need to think about the interpersonal relationship and the intrapersonal relationship. Intra is I relate with myself. Inter is I relate with others. So these two different types of relationship we need to know. Normally, if you have a good relationship with yourself, it's easy for you to have a relationship with outside. That's a research says. Next is life transition support, aids in coping with major life changes such as marriage, parenthood, and also retirement. If we look at what are the common issues faced by adults, we already have seen it in the first PPTs itself. Work-life balance and job stress, relationship conflicts and family struggles. I'm trying to bring it more in significant as such because these are the main problems, issues we have it when adult comes for counseling. Mental health concerns like anxiety and depression, certain times also like phobias, then financial stress and decision-making challenges. So we need to remember when they are trying to be dependent, the finance is becoming a big problem for them. All these years, they would have been depending on their parents. When they have to make a shift in their mind as well as shift physically, so there is a lot of pressure, there is a lot of stress due to finance. Of course, then again, now they can't depend on their parents. Decision has to be made by themselves. When they do not have self-confidence, whether this decision is correct or not, they are not sure about it. As a result, they need to approach a counselor. Just make sure to have a certain clarity in their decision making. What is the importance of counseling adults? Encouraging self-awareness. As a result, personal growth takes place. Provides tools for managing stress and emotional well-being, because emotional problems are occurring. So here we give importance to manage the emotional well-being or manage the emotions. As a result, emotional well-being takes place. Strengthen relationship and interpersonal skills. I would also add, as I said it, intrapersonal skills. Then enhances resilience and problem-solving abilities. So all these life skills are coming one after the other. The previous one, you saw it, decision-making. Here, you're looking at the problem-solving. So if you look at the future trends in adult counseling, rise of teletherapy and online counseling services, increased focus on workplace mental health programs. So if you look at like Infosys, Wipro and all those, they are providing counselors as well as a wing there is where they can go and speak, especially like Bangalore, I have visited once or twice, Wipro and Infosys. They are taking, the management is taking care of their workers, especially when they face with the stress and a bit of personality disorders. So they provide them with the classes as well as a personal counseling. Then integration of mindfulness and holistic wellness approaches. Of course, nowadays, this mindfulness is a booming topic. People all will speak about. The importance is that when we live in our past, we are worried about it. The dead past, we are repeatedly bringing it into our mind. Other choice we are having is living in the future, unknown future. We fail to live in the present. So this mindfulness will help you to live in the present and in a way to enjoy your present moment. And holistic wellness approach. Let's not be in a one-sided. A comprehensive approach is needed. That is a holistic wellness is essential for us to live as a human being, to live as a happy human being. Expansion of group therapy and peer support networks, because group therapy will strengthen, because when they share it in the group, what happened? It's not only the problem is for me, others also are facing the same problem. Otherwise, this repetitive negative thought will go on in our mind, or the self-talk that only I am facing this problem, nobody else is having. So I think we need to compare this 3 C's. The 3 C's are, one is, I think some of the students will know because I've already told them: criticizing, comparing, and complaining. I think these 3 C's we need to avoid, because group therapy will help you to avoid comparing or analyze it. Okay, so these 3 C's, even in our day-to-day life, if you can avoid, I think that is the best, happiest moment you can have it in your life. And the sum total of some key takeaways are: adult counseling is essential for personal, professional, and emotional well-being in 3 different phases: in my personal life, in my professional life, and for my emotional well-being or for my mental health. Counselors provide guidance in managing stress, relationship, and career growth. You remember the aim we had is similar. So here we are trying to fulfill that. Here, when we talk about guidance only, we are not only speaking about counseling. You may remember the difference between the counseling and the guidance. Guidance is just in a general term, we say it as a advice or directions you are giving him for a decision making. Whereas counseling, it is a depth. You're touching the emotional problem. In guidance, not necessary to touch the emotional problem as such. Then again, addressing adult challenges early leads to long-term well-being. So when the problem begins itself, if you are able to understand or identify and understand, then it is a long-term well-being can happen. Otherwise, once it reaches, just like the other cases or cancer cases and all that, first stage itself, if they go to the hospital, they can do some treatment, then they can come out of it. Same way, even mental problems also the same way. Try to identify as early as possible, especially with your thinking, with the self-talk that you have. Then future trends will continue to shape the accessibility and effectiveness of counseling. So when we look at it, the accessibility and effectiveness of counseling will help you to live a better life in the future. So these are some of the, on the whole, when we say about the key takeaways. So keeping some additional resources, that is therapeutic techniques, mainly we focus on cognitive behavioral therapy. I think number of times you would have heard about this. So this is one of the most commonly used therapies to help individuals to manage their anxiety, depression, and other mental health issues by changing negative thought patterns. So what is happening in cognitive behavioral therapy? There is an activating event. It comes to the feeling level. If your thinking is irrational level, the outcome is negative. If you think it in a rational level, the outcome is positive. So that is all is happening in a CBT. But in an elaborative way, we do it in different sessions. But the simple concept is this: your irrational belief, you are changing into rational belief. As a result, the positive outcome. Then dialectical behavioral therapy, which is called as a DBT, often used for those with borderline personalities, like people who are at the verge of depression, a type of disturbances in their thinking. So this type of people, emotional regulation is difficulties. So DBT focuses on mindfulness, live in the present, not to be in the past or to the unknown future. Distress tolerance, we need to tolerate a certain amount of distress or a stress. We need to have a capacity to tolerate it. Again, have a mindset to regulate your emotions. As I said it earlier, build interpersonal relationship. Quite often I have noticed with a client, when they do not have relationship with them. If the husband is coming for counseling, may not be having relationship with the wife, vice versa. When wife is coming, not having a good relationship with the husband or with the in-laws, or all the surroundings in their family or from the background as such. Here, the person-centered therapy. This therapy emphasizes the client's ability to find their own solutions. Problem is there and find out solutions from them itself. You remember the 13-step PPT I showed, from the problem, O starts the solution. So here the person-centered therapy with the support of a compassionate and non-judgmental therapist. So here we person-centered, especially when we use it, we need to be in advanced empathy. I'm not talking about the fatigue empathy, but be non-judgmental without any bias. Next is a trauma-informed care. For those dealing with past trauma, a trauma-informed approach ensures that therapy is conducted in a way that avoids re-traumatization and promotes healing. Now, for example, like earthquake cases, when there are people who are the victims of earthquake or flood or tsunami. So all these cases, we have to be careful by making them to recall it, that can occur re-traumatization. As we spoke already about mindfulness and meditation technique, many therapists integrate mindfulness and practices to help with stress management and emotional regulation. So remember, mindfulness practices help with stress and emotional regulation. So this is the core of mindfulness. That is being in the present, not to be living either past or in the future. Then we also need to have a peer support groups. Nowadays, a lot of online support groups are there, but make sure where you are joining is reliable group. Many individuals benefit from connecting with others who have similar experiences. Here again, online, the person is, now we are having a class here, online classes. So what happens? Really, there is no question and response is not really happening here. Normally in the classroom setup, by now students would have asked many questions, but here it is not possible for us. Okay, there are numerous online support groups for mental health, addiction, grief, and other topics, even depression, all these things. There are so many online support groups are there. Some of it I'll be explaining it little later. Then in-person support groups. Some of the organizations like National Alliance on Mental Illnesses and various addiction support groups, AA, that is either in India as well as in other countries, can provide community and shared experiences. This again, a type of group therapy session. So group therapy, some people find that group therapy is a helpful option to address issues in a shared space with others facing similar challenges. The reason for challenges is that people don't take the initiative to trust the other members of the group, or they lack confidentiality, they feel, because anything is said, it can reach to others, their own friends. So there are also certain challenges when we have a group therapy. So normally in a group therapy, we advise the students to promise to themselves that whatever they speak within the group, it will not go out of the group. That promise always we make it during the group therapy sessions. Then some of the digital mental health tools are apps for therapy and well-being, apps like Calm, Headspace, BetterHelp, and Talkspace allow individuals to access therapy on mental health resources conveniently from home. Now, you people are sitting in your own house and you are seeing it. Same way, all these different types of apps can help you to have a mental health or relaxed mind by following it. There are also self-help resources, that is online platforms or website offering certain type of articles exercises, and guided meditation support the individual's mental health journey. Now, like certain type of researches are available. Google Scholar, all these researches are available in India itself, or you can enter into the library of any universities. You can get some of the articles. So crisis resources, hotlines are there. That is a national helpline like the Suicide Prevention Lifeline or the crisis text line offer immediate support for those in crisis. Now, I see it when we read the newspaper, especially in case of suicide, at once they will give a number, kindly call us. When you face with this type of trauma, or when you have an emotional problem, or when you have a tendency to feeling of committing suicide, please call us in this number. So if you could notice, those are helpful. Then local emergency services, where someone is in immediate danger or experiencing a severe mental health episode, it is essential to contact local emergency services for a mental health crisis team. Some of the specialized support are couples or a family therapy. I'm just going ahead because it's already time. I have to complete the elderly patients also. Addiction counseling and life coaches and mentors. You can read it this little later. Mind-body approaches, that is yoga and exercises, art or music therapy. Quite often I have seen in some of the centers, this is really applicable, and it's really flourishing, like art and music therapy. Especially people who have skills in all this, you can easily help them to relax their mind and come out of their problems. Then some of the psychiatric support, make sure when all these are a failure, all these therapies are a failure, talk therapy, then only you preferably advise the adult to go for a psychiatric support. That is especially like in case of depression or mania or bipolar disorders, antidepressant or a mood stabilizers tablets can be given. That is maybe next week, the psychiatrist will give you more explanation about it. Then community and social services are there. Some of the local community mental health centers, in many of the districts, we have seen it like mental health centers are there, even in the government hospitals. You can approach them when you see this type of cases. Employee assistance programs. This is what I was trying to say. Some of the industries, Wipro, Infosys, they have an employee assistance program. The workplace itself, they will be provided confidential counseling and resources for our employees and their families. Because we as a group, we go to different places to give one-day session for the employees. And also one group will be giving them an individual counseling. So here we have a case study. Sarah's journey to work-life balance. We will have a break room session here. The background is this. Sarah is 35 years old, professional, struggling with the workplace stress and strained relationship at home. Here, I have given you the counselor's intervention also, introduced time management techniques and mindfulness practices. The outcome is Sarah improved her work-life balance, leading to better mental health and relationship. So in three of you in a group, you're going to discuss what were Sarah's key challenges. It's already given, but still you will discuss it. How did counselor's approach benefit to her? So you as a counselor, how it can be. What additional strategies could be used in similar cases? I hope it is clear. So we shall have a break room session. Dr. Balaya, sir.
Creating the classrooms.
Yeah.
So in a room, 3 participants or 4, sister?
Three, sir. 3, yeah.
Okay, fine. All right. So 3.
3 minutes.
Yes, 3 create, yes. I am creating the room. So I am opening all the rooms. Mohan sir, could you unmute your mics, please? I am opening all the rooms. Mohan sir, could you unmute their mics, please? Participants, now you can join the rooms. Assign to room 1. And assign to 2, assign to 3, assign to 4, assign to 5, assign to 6, to 7, assign to 8.
They're all mute still.
Huh?
Are they
I think-
mutes?
No, yeah. Mr. Mohan?
Sir, unmuted, sir.
Okay, all right. Thank you. Yeah.
Maya பண்றேன் வளையா
In room number 8, no one has joined. Monisha, David, Sam, Paul, Joel, you have not joined. Number 8. Gayatri has not joined. Akshay Edward has not joined.
Sahira Begum is not joined. Our students only.
Shall we close the room, sisters?
Okay. 3 minutes are over now. Yeah.
Yeah, okay, yeah. So,
Another
they,
6 seconds will be
yeah,
there.
they will return to the classroom in 60 seconds.
Yeah.
Record session open madam. என்ன question கேட்டேன்?
எதுக்குடா குடுத்தீங்க ஒரு 4 வாட்டி பேச
PPT is not moving, sir.
Sister, I have a question. It's a continuation of the discussion we had just now.
Okay.
So I was okay. As per your PPT, the counselor advised the candidate, the client, about time management things, and then she has to, and she was okay with after she tried to manage her time. Then everything worked out for her. Is that true?
Yeah, continue because it's going off in between. Not clear.
Someone is disturbing. Okay, sister. So
Yes.
So it's when the client was asked to manage her time effectively, she returned to normal without stress kind of lifestyle.
Yeah.
Okay, so what if it is a pressure from the management, from the peers, from her colleagues, from in a college setup, we do have pressure from other departments and the management trying to get all the file work done on time.
Yeah.
So in that case, if the peers are not cooperative, then how would I manage?
One is you need to prioritize what is necessary for you. What are the priorities? Second is building relationship. So if you could build a relationship, this pressure can be reduced. The only way is that. So from the higher authority or from the other colleagues, all this is when they know. And certain times you can openly say, this is the problem that I am facing. So be open. And also create an environment for them to know this is a struggle that you are going through. You don't have to hide because all are not perfect at all. We all have one or the other way certain types of problems. So you can always open and say, this is the problem at the moment I am going through. Please help me out.
How long do you think this takes for someone to get things right or get set the things?
Can't specifically point out and say this long because it depends upon the mindset, their environment. You remember the reframing session when I told you meaning and the context. Here you need to understand what is the understanding of their meaning, what is my understanding, what is the context of ours. So we need to reframe that. So it depends upon each one. Depends upon your skills. I cannot specifically say that this long is needed or this many months is needed. No, some people will understand the meaning and reframe it very easily. Some people are able to now use it. The context is totally different as a lot of pressure is from. So in that case, you need to reframe the context. So that might take long time because it is not only within your control. It is also others are involved. So you have to give be compassionate and be gentle with yourself. And then the same way, be compassionate and gentle with others. That's the only thing I can say is because that makes a lot of difference.
Okay. Thank you, sister.
Thank you. Good. Good question. Others, if you could come up. Any reflections that you would like to share? Nobody wants to come up, I think.
Good evening, sister.
Good evening.
Okay, so I was also in the room with Ramalakshmi ma'am. So we were just about talking about the pressure that Sarah was facing as well as we usually face in the background. So I would like to put a point here, since she was saying like everywhere she has a lot of pressure and like from the peers also. So what I felt personally was it is never wrong to ask help from the colleague. And also, since I'm from the HR background, there is always an HR who would like to help them. So approaching an HR and asking for help from a colleague wouldn't put us down, is what I felt from the discussion we had in our group. As well as having a schedule plan and managing time will also be helpful for any person to balance the work pressure as well as the work-life balance, is what I felt while having the discussion.
It's a good point. It's a good point. Very good. You can also get some more insight like this way. Good, very good. Good. Anybody else is there?
Good evening, sister. Myself, Divya,
Yeah.
from Wipro, as you quoted. Previously, you have given classes for Wipro and Infosys, as you told. So, I have attended the previous sessions as well from St. Joseph College, which was organized by Dr. John Sir as well. And the upcoming things that actually we are currently facing in trend is, as people mention, it's work-life balance. But if you have gone through the interviews by Indra Nohi, the former PepsiCo director, and many other people, it's never called as work-life balance, is what they say. If you are able to balance things, you will not be able to take up the pressure. It's just juggling, which is priority for first. This was what was taught for us in the previous sessions. They will be having a 4 quadrant. In 4 quadrants, they mainly set up things like high priority, low risk or low pressure, or low priority, high risk, high pressure, and vice versa. So, in that, you have to juggle between things to come out of your pressure. It is very simple as that. So, this is what was taught. I would just like to bring this thing to the limelight.
No. What is your question as such? If that is a scenario, what is your question?
So, I think people have moved way further more. Apart from work-life balance, continuing stating that it's never work-life balance, it's between juggling life.
I don't, it's partially I agree, but again, it depends upon your mental maturity. We need to have a work-life balance. Otherwise, we can go into upside down. Because what is your priority? Maybe if you're a married person, husband, children, family is also priority, as well as your professional life, your professional life, the co-workers, the higher authorities, all this has to be included. So we need to be like a bridging. All these cases, bridging. Again, once you have confidence in yourself, and if you are free from the negative self-talk, I think this is all possible because all these years, people have lived ahead of us. So I think it's possible. Of course, depends upon our mindset.
You got your sister.
Sister, I think she has got a point.
Yeah.
The point is, with the arrival of the COVID-19, that work-life balance it's been in a good of life because most of the people they're working from home.
Yeah.
We cannot easily compare that this is my housework and this is my industry work. Like many times what happens in today's industry world, what happens is that most of the works are done from home. Like, well, there is a
Yeah.
point in what you're saying that we must maintain work-life balance in
Yeah.
order to maintain a sound
Mental health.
mental status. Yeah,
Mm.
but after the COVID-19, we cannot strictly talk about work-life balance. Like now, what people are saying, the reason the trend is that we integrate.
Yeah. Yeah.
Integrate. Sometimes we integrate at home. Sometimes we integrate the family in the workplace. So we cannot purely compartmentalize. This
But
is what she's
even
trying to
then,
say.
yeah, even if they are working from home, but pressure from the authority is there. No?
No, sister, I'm not able to get you. It's like a lot of background noise.
I think others could mute.
Hold on, I will. Yes, okay. Hello, Celsius.
Okay.
I have put
Muted.
everybody off. Yes.
Thank you, sir.
Okay.
What do they simply put on the mics and they're listening to other conversations. Like,
They're having their
okay. Yeah, that's what I understood from Divya Sridhar. She was trying to say the same, like, you cannot strictly compartmentalize.
No, sir. Like what
Celsius
I'm
Sri,
trying to quote is in our
yeah.
previous sessions, we also had the same kind of session stating work life balance is no more a work life balance, it's juggling between the things. And now, where it is
Ma'am, I am
coming
also,
into
I am also actually trying to say the
controversials
same
where
thing.
each and every CEO states that you have to work for 90 hours, you have to work on Sundays, you have to extend your shifts more than 15-16 hours. It's not about the extension of hours. It's like you are not able to prioritize what you have to prioritize. You are physically and mentally challenging both your health and both your mind, where extensive of hours are there, but you are not worth it doing that much, and where you are ending up paying for something else is what I just bring into the table.
So the trend is not work-life balance. The trend is work-life integration.
Yes,
So
sir.
that's where we are aiming at. Okay.
Yeah. Shall we go ahead with the counseling the
Yes,
elderly?
go ahead.
Sure,
Yeah.
sister. Thank you.
Okay, thank you. So now let's look at counseling the elderly. So here the approaches, challenges, and strategies for effective counseling. So when we look at the elderly, the counselor has to be really, really extra kind towards the person and more of engaging the family and adapt your approach. So what exactly is elderly counseling? Counseling the elderly, the people is just, in a short, I will say, emotional, mental, and social well-being of individuals around the years about 65. Then understanding the needs of the elderly here, physical health challenges are there. The elderly are going through a chronic type of illnesses. They have the mobility issues and sensory impairment, not able to hear or partial blindness, all this type of things can happen. Then mental health concerns are like depression, anxiety, dementia, and loneliness. Social needs like loss of social roles. All these years, they would have been a significant person in the society, but all on a sudden, it is all stopped because of the age. Then family dynamics, especially the isolation. Then common psychological issues in the elderly are mainly depression, anxiety, dementia, and cognitive decline, especially in challenges in communication, not able to express what they really think because of the forgetfulness even, then certain types of loneliness. Then counseling techniques for the elderly is active listening. Here, active listening, we would have already spoke about it. really looking at their feelings and learn primary empathy and advanced empathy. Here, as we spoke, person-centered therapy, respect the autonomy, dignity of the individuals. CBT, we already said, reminiscence therapy, that is engaging in the life history discussions. This is something that I practice with the elderly, especially with my mother, who is 95-year-old. She repeatedly ask her what were her achievements, what were her previous happy moments, which will give her a lot of happy hormones, like dopamine might increase, endorphin, oxytocin, serotonin, all these happy hormones will increase when they recall the happy events of their past. Then, of course, solution-focused therapy, empowering them to address the challenges. Some of the psychological issues in the elderly are depression, often goes undiagnosed, related to loss and health decline, and anxiety, concerns about the health. Sometimes we have noticed health is not that serious problem, but they're thinking about the health is a serious problem. Then financial stability, then end of life issues, what happens towards the death, who will look after me, though there are people, but will they give up? Then dementia and cognitive decline, challenges in communication. Of course, the memory loss is a big problem. And loneliness, that is a social isolation and a diminished social network. Some of the techniques for the elderly in counseling is active listening, person-centered therapy, cognitive, sorry, it's repetition. Physical limitations, hearing loss, mobility issues affecting the counseling process, cognitive decline, that is difficulty in their comprehension and decision-making, resistance to change, because long-standing patterns of behavior they had, and all on a sudden, even to ask them to change, it's very hard. Even to change them from one room to the other room is very hard, because they are attuned to that particular environment as such. Then stigma and ageism. Ageism itself is a problem. Then social barriers to seeking help. Building trust and rapport is important. Respect and patience. Be empathetic to their self-stage and experiences. Creating a safe space, non-judgmental and supportive environment. Clear communication. Speak clearly. Avoid jargons. And or especially now we have a lot of internet terms, preferably to avoid all those terms with them, those jargon which that then give them a time to respond. Don't expect them to speak as you speak, give them a time. Here too, silence is important. Then cultural sensitivity is a big problem. Understanding cultural belief, respecting different perspectives on aging, family, and health. Because traditionally they have lived a life. Now the new generation has got different way of thinking. So that itself is pulling them down. Then tailoring different approaches like cultural background when designing interventions. Family involvement, that is very, very essential, especially with the culture. Family plays a critical role in elderly care. When we look at some of the strategies for specific issues, for grief and loss, helping them to cope with the loss of loved ones, their identity and independence. End of life issues, discussions around legacy, fears and planning. Then cognitive decline, memories aids, focusing on strength, social isolation, encouraging community involvement and societal activities. Some of the ethical considerations are confidentiality, respecting privacy, especially when they are a type of dementia or a cognitive impairment when they have. Informed consent, make sure that you, even if they are a little bit disturbed mood, ask them whether they really understand it. So informed consent is necessary. Autonomy versus protection, that is balancing respect for the independence and ensuring safety. What are some of the benefits of counseling for elderly people? Counseling provides a wealth of advantage that enhances the lives of elderly individuals in various ways. Now, this is very important in case of elderly people. Emotional health effects allows healthy expression of difficult emotions like grief, sadness, depression, anxiety. Helps seniors process trauma, loss, and major life changes. provides outlet to combat loneliness and isolation, boosts self-esteem and self-worth. So this is the benefits of going for counseling. Now next is mental health benefits. Enhances cognitive abilities and memory, delays onset and progression of dementia if they are mentally healthy, developing coping strategies for living with Alzheimer's diseases, managing symptoms of mood disorders and depression. Some of the chronic pain management through counseling is lowers pain levels by reducing stress and anxiety, teaches relaxation techniques like meditation, deep breathing exercises, boosts mobility through gentle exercises like ask the elderly to sit on the chair and move the hands up and down just as much as they are able to bend, lift the leg. So this type of small a type of yoga movement exercises will help them, fosters better sleep and increase energy level, especially drinking a lot of water, because fear of going to the toilet, they prevent or they avoid drinking more of water. That itself is causing them dryness. Then increases social support, encourages community engagement and socialization. Maybe though they are not able to walk, maybe we could support them to take part in the socialization. Then provides access to support groups and networks. Like within the village itself or within the city side, it's a particular place we could have a support groups and to build a networks, enhances communication and relationship with the family, reduces isolation through interaction and companionship. Most of the cases in elderly, isolation is the biggest problem because sons and daughters are running for their job, looking after their children. So they intentionally, they may not be doing it, but they are feeling it. This is the isolated time as such. What are some of the common challenges faced by elderly people are? They encounter major issues spanning mental, emotional, and physical health. When we look at the mental health disorders, Alzheimer's disease, dementia, Parkinson's disease, and stroke. Emotional ones are loneliness, grief, anxiety, depression, and low self-esteem. Physical health is chronic pain, reduced mobility, decline in sensory abilities, multiple compromised conditions, increased risk of falls and fractures, because they may not be even like a small step from one step to the other step. When they climb down, they will not be having the balance. So those type of fractures are very common. Falling is very common. So these challenges can severely impact their quality of life. So counseling aim to equip seniors with effective strategies to prevent or manage such issues. How can counseling help elderly people cope with these challenges? This counseling approach that benefits the elderly include grief counseling, provides support for bereavement and loss. Maybe the husband and wife living about 80 to 90 years old, all on a sudden, one of the either husband or wife, when they're dying. So it's a real loss for them. They cannot cope up with it. Then allows healthy expressions of grief, fosters acceptance and healing. End of life planning encourages discussions about end of life choices, how they like to be in their end of life burial. All this can be discussed well in advance. Helps finalize legal documents and wills if they could have the documents. Then offers perspective on finding meaning and closure. Dealing with the dementia and Alzheimer's and Parkinson's diseases teaches coping technique to manage their symptoms, especially these three important diseases that is faced commonly by the elderly. Provides cognitive exercises to delay progression. Some of the small exercises that we ask them to count back from 100 to 99, 98, that will help them. Like some families I have helped is asking their mother, what are the names of the children, where they are working. So all those, if they are able to or recall it, which means that so much of dementia is not there, still we can bring it back because the cells can be rebuilt again, even in their old age. That is a research says. Then offers stress management, ease anxiety, connects caregivers to support networks. What are some resources available for elderly people who are seeking counseling? Seniors have various options to access counseling services, resources for mental health services like psychologists, psychiatrists, some of the therapists, psychotherapists are there. Then certain programs are in hospital programs and community clinics. This community clinics not much developed in India, but other European countries, it is very common. Resources for emotional health support is mainly the support groups and telephone hotlines, online forums and chats. Social support networks for elderly are senior centers, adult daycare program. Some of the places, the adult care program is really doing well. And nursing homes, faith-based organization, retirement communities. Tips to find the right counselor. Sometimes we find it hard, but get referrals from healthcare providers, especially like in TamilNadu, we have the panchayat level, they have the hospital, means they are providing this mental health support also. Check credentials and specialization, have an introductory session with the counselor so that you will know what is the attitude. Then consider gender. Suppose the female means female may like to have the female counselor or male would like to have, but vice versa also is true. Then age of the counselor is important and the person and the cultural preferences. What are the signs an elderly person may need counseling? Look out for these signs that indicate a need for professional counseling. Recognizing early signs of mental health disorders, memory lapses beyond normal age-related decline, impaired decision-making and judgment, changes in mood like depression or anxiety, withdrawal from social activities. Quite often I have noticed this type of elderly person, they don't like to come for social activities and poor decision-making, and the type of depression or mood changes will be there, and always tense, stressed. Anxiety is the forefront. Then emotional health concerns require support. Allow them to express the grief, sadness, or loneliness persistently. Especially when they come for counseling, they may take longer time because this expressing the grief is because problems shared are problems lightened. So allow them to speak as much as possible to let out their negative emotion. Yesterday, sir was telling about a catharsis. Then talking about feeling worthless like a burden. I mean, when they reach in the 80s to 85, they always think I am a burden for my children. My children should not suffer because of me. So maybe you could make the reframe their mind as such. Discussing meaninglessness or suicidal thoughts. They also have, especially like men, the statistics says is men who are over 80, they always feel the tendency for the suicidal thoughts or tendency to commit suicide. Even nowadays, in all the ages, we cannot predict as such. Then some of the signs of need for social support is loss of loved ones or retirement leading to isolation. Because all this active age, they were really working hard. Then all on a sudden, the retirement came. They don't know how to handle the retirement stage. So this retirement has to be pre-planned well in advance. Maybe if they're going to get retired 58 or 56 or whatever it may be, at least when they are 10 years before that, they need to plan out what they are going to do. Otherwise, this type of problem can occur. Lack of interactions with the family and community, difficulty performing daily activities independently. Sometimes even the minimum activities like brushing the teeth or having a bath by themselves, or all these simple things, washing their own plate, all this can be allowed by themselves to do. If it is not, then there can be a later stages of problems. How can family members and friends support an elderly person who is seeking counseling? Loved ones play a key role in encouraging seniors to access counseling services, family and caregiver support roles. Have a caring conversation about getting a help. It's always nice to straightforward in a gentle way ask the elderly how you need to be, what type of help you need. Can I help you out? So maybe as a family member or not. So this can be education can be given by the counselor to the family members. Then assist in finding providers covered by different types of support. Now we hear that certain banks, if you give your property to the bank, they look after. And they even see to their burial thing and last rites and all that they are seeing. So find out in your area, what type of help is there. So you can, as a counselor, you can give this information to the elderly or the geriatric. Provide a transportation to and from appointment. So whenever they have to visit a hospital, make sure that some transportation is provided for them, or well in advance make the appointment. Share insights with counselor to enhance care. So enhancing care is important.
Sister.
Then building a supportive environment.
Sister.
Few more, sir. I'll just complete this.
Okay, because you have given a lot of inputs. Maybe
Questions.
the participants, they may have a lot of questions like. Yeah.
Okay. I'll just few more this only, then we can stop it.
Okay, all right.
Be patient and avoid dictating pace of counseling. Celebrate progress and milestones in treatment. Maintain stable routines to ease anxiety. Create opportunities for social engagement. Maybe this I can skip. As a conclusion, as people live longer, there is an urgent need to expand elderly counseling services. Counseling allows seniors to process challenges, enhances emotional resilience, and fosters social connectedness. With support from loved ones and access to resources, the elderly can age wisdom, dignity, and mental health or mental well-being. So, rising awareness about the benefits of counseling for the aged population will encourage more seniors to seek help with an empathetic, inclusive, and holistic approach. We can enrich the lives of older adults through counseling. Okay, this is a case study. Let's just read it, but they can do it by themselves, so they can ask the questions. Yes, sir. If they want to reflect on this case study, they can go ahead. And a case of simple one, a case of an elderly woman struggling with depression after her spouse passed away. Intervention is active listening, reminiscence therapy, involving family for support. So we could discuss and report the further role of a counselor. So now it's open for questions.
Actually, sister, I have a real life example of such a couple who is so worried that actually her husband didn't pass away, but still she was so worried that her husband passed away, and she herself fell into depression in the due course, and now her husband recovered, and the lady is in deep distress.
Yeah.
The only thing she asks is, like, she needs someone to speak to. That's the only thing she asks for. And
what about the husband? That's the husband.
Yeah, he is there. He is taking care of his wife now. And usually it's him who used to give all her diabetes medicines. Whatever medicine she takes a handful of tablets. And it's always the husband who gives her all these, the bunch of tablets. And when he fell down and he was sick, she went into depression. He came back out of sheer willpower, I should say, that to take care of his wife. But the lady, she broke. She's completely broke. I used to call. That's the only thing I could do. I'm not her family member. Her family members, as you said, they are engaged in other occupations like job and things like that. And the only thing she needs is someone should speak to her.
Yeah,
Other than
yeah.
her husband, like they have been together, they are 85 and 86 now, and they have been together right from the age of 15, 1-5.
Yeah, yeah.
She
It happens
needs,
sometimes that they long for the presence of someone to pour out their feelings.
yeah,
It would have been a
whatever it is.
suppressed, yeah, suppressed feelings. A lot of suppressed feeling would have been there. So that is one of the reasons. And again, when we talk about females, they totally feel that I am nothing. I am a burden for others. So that type of mentality, if they have, then it is very, very hard. Men somehow find some way out to come out of this emotional feeling, but the females, the study says it's very hard for the females to come out.
So what do you
Again,
suggest?
exceptions are there. Yeah.
What do you suggest for them?
I mean, spend time with her. She can all. Did she meet any counselor so far?
No.
Maybe we
She
could.
has all the physical ailments.
Okay, I mean, physical ailments, she must be seeing a doctor, medical doctor. But this, if she could pour out to a counselor, and the counselor could help out. Of course, other family members. What about the other family members?
They are in different parts of
Okay,
the state.
these two are living alone.
Yeah.
So maybe here the care of her husband alone is not enough. At least
Oh,
some
he's-
relatives. Yeah, some relatives could help. Any grandchildren or anybody?
They are, but they never think about.
That also makes her to be that. Going into
Yeah.
that depression. Mainly if they have grandchildren, if they are able to pass their time with them, talking to them, spending time for them, buying certain things for them, that itself is an occupation for them. So they will not get into much of depression.
But nobody cares. That's the one thing that's pricking her mind. That's the back of her mind always. Nobody
Yeah.
thinks about her. Nobody comes and talk to her.
Yeah.
He's
If you are able to talk to her over the phone, can you change that belief of hers saying that, no, there are somebody for me. My husband is there for me. What else more I need? If you could give such type of promoting energy for her, it will be very good. Encourage her that there is someone for you. And at the very fact of you talking that I am there for you.
Yeah.
Yeah.
She wants my presence there. Like you said you will take care of me. You had left me alone now. That's what she used to complain.
Yeah.
Thank you,
at least
sister.
over the phone, even if you're not able to physically present, at least spend some time daily. If you could at least talk for now, this one, then it is be good.
Yeah.
Okay, thank you. Good for sharing.
Hello.
Yes.
Can I?
Yeah, yes,
Yes.
go ahead, Sasi Ronaldo.
Yes, sister. I have a clarification with regard to the previous case study, and I have a similar family of facing the same problem. Like, in the sense, the husband goes for work in the afternoon and comes back at late night, and the wife goes for the work around 10 o'clock at night and comes back in the morning around 5 to 6.
Night shift.
And among them, the child is really struggling to meet the parents together. And the boy goes for the school when father is already asleep, and when the mother is already in a place, in a mood to sleep. And when the boy comes back, both are not there to receive him, and they are at the work. and there is no proper guidance to the boy. And the husband, as such, when he comes at late night, he goes to the pub or a restaurant or the bar and spends the whole night with the friends and with female friends as well. And she's the lady, she is not able to bring husband back to the normal life, but then she wants to go to work to earn for her son's education and the family running. And the husband as such is not willing to pay back or take care of the expenditures of the son. So she's finding very difficult to go to the office and then work there and then come back home and take care of the child. But the child is always in loving with the father. And this is what her mindset, having trouble in the office and at home, the husband is behaving in an indifferent way, and the son is not loving her, but loving the husband who is not at all being with him, and she is worried. And what would be your suggestion to such a client, sister? That's what my
Yeah, good question. It's a scenario that is very common nowadays because most of the students, they will come and tell this one or the other different types of problem. Here, I think the parents need counseling rather than the child. First, maybe the father should be tackled. Somehow make him aware what is his responsibility. And how the lady is pressured because of him as well as the child. The child's pressure from both the parents. I'm sure the child may not even be able to concentrate on his studies and various other activities. So when there is a poor performance, somehow we need to make the husband or the father become aware that he is responsible for the development of the family, support the family and the wife and the child. Then later stages, stress management has been done for the mother also. After tackling these two, husband and wife, then maybe we need to help the child. So here we need to have 3 different sessions as well as together.
But in this case, the husband is not at all feeling that the problem is from him. And the lady is always open for going for a counseling. But the husband is not at all finding he's doing something indifferent to his own family. And he's simply saying, I'm going for a night work and then I need to rest sometime and I need to spend time with my friends when I get free time.
Okay. We may have to assess a little bit of his past history, where it all began. Is it the same case before his marriage? Somehow we have to make him aware of his responsibility. That is, he may be resistant, but still within the friendship circle or family relatives or somebody, we have to make, through them, you can make him aware that he is not responsible for his family because ultimately he has a son. He is supposed to take care of him. So those type of awareness has to be given. Then slowly you can root out what are the small problems are there. Slowly we can help him out. First,
so it is a dysfunctional family. The family system has, collapsed. So they need family counseling. So with that comments, so we close for today. And ladies and gentlemen, thank you very much for your wonderful participation, Dr. Shobna. So you have given a lot of inputs for reflections and for practice. Thank you very much. Good night to all of you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Welcome. Yeah.